welcome back to the Workforce Minute. Today, I wanted to give you an important update. Today is just September 7th, 2021, and we had a lot of progress over the past couple weeks. Just 2 weeks ago, we met with the leadership of HCA, and specifically Dr. Rosenberg, myself, Dr. Schneider, and Ms. Sidori from ASAP met with Mike Cuff, who is the president of the Physician Services Group, and Bruce Dayton, who's the president of GME efforts at HCA. For those that don't know, HCA is the largest for-profit hospital system. They now have 185 hospitals, and they have been very invested and forthcoming in developing residencies. And the point of our meeting really was to have a conversation about the growth of residencies and really how we can continue that growth responsibly and not overshoot with workforce issues. And this is really where I find the value of ASAP. Really, I don't know of any other medical organization that has the authority, the autonomy, the ability to meet with some of the largest hospital systems and have a one-on-one conversation with their leadership. And this is where I think the membership value of ASAP is so important, is driving these conversations and having what can be, frankly, some difficult and uncomfortable conversations about where we're going with workforce, what those drivers are, and how we can work together to solve them. I think the meeting actually went very well. It was really an introductory meeting to know who each other are, what our backgrounds are, what our interests are in GME. And we learned a lot, both from HCA, and I think they learned a lot from us. One of the things that stood out to me the most was that HCA has been looking at workforce data over the last 20 years. And to their credit, most of the workforce data has said up until now that we have a workforce shortage. And they were quick to point out the AAMC data, which also shows there's going to be a workforce shortage of all physicians. And they were using that as a means of trying to solve the problem and to really start GME programs, not just in emergency medicine, but internal medicine, family medicine, anesthesia, psychiatry, to really meet that gap and to really serve that purpose of training the physicians of the future. And they're very proud of that mission to help grow GME. But what they didn't know is in that AAMC report, if you forward to page 30 something, they do break it out by subspecialty. And their predictions were specifically for emergency medicine that they predict a surplus of close to 10,000 emergency physicians, which matches up pretty well with our own ASAP data. And so my impression was that at first they were skeptical of our workforce data. They weren't sure that it was supported by other literature. But my impression was that after looking at multiple sources that now sort of predict that same number in 10 years, that maybe growing all specialties isn't really the solution. Maybe it's focusing on the specialties that really are in a deficit, that we don't have enough or in certain areas. And so I think it was a very good, frank discussion. They were quick to point out that many of the residency programs they've started are in rural or underserved areas, and that they are looking to try to train more physicians to stay in those areas. And that's something that we will be looking at, as well as HCA, of looking at retention. So what percentage of people who train in those specific rural areas, do they stay, or are they net exporters? And so they looked at that. We also discussed academic rigor and scholarly activity and our concerns that some of the newer programs may not have the same bar when it comes to research and scholarly activity. And it's something that they are also looking into. But most importantly, it was an understanding of where our numbers are. And they really felt initially that they weren't part of the problem, that there were other forces like nurse practitioners and PAs that were changing the demand for emergency medicine. And we did share with them some data that I think I've shared with this group previously, of looking at, who are the drivers of growth in emergency medicine. And we showed them this slide, that of all the health systems, HCA is actually number one. And this was a needed and slightly uncomfortable but important conversation of helping them understand that they now have 16 affiliated emergency medicine residencies. So they are one of the largest drivers, especially in Florida and in Dallas, that is impacting the emergency medicine workforce. And they asked me specifically, how has this impacted emergency physicians? What are some of the unintended consequences? And I was able to share some personal stories of some of my former residents who are in Florida, who have graduated from residency, but their spouse or significant other is doing a fellowship or finishing their residency, and now they've been unable to match literally in the same state. Many of whom have young children or infants at home, and now they have to have a commuter marriage with families, and that this is really having an impact on the workforce that they are trying to support. And so I think it was necessary and it was helpful to share kind of some common data and some concerns we have about the future. I think overall the meeting went very well. It was very collaborative and they were very open to suggestions and information from ACEP on how we can work together to solve this problem. And maybe looking in the future of changing some of those GME slots that were slotted for emergency medicine to flip into fellowships or even other medical specialties, of how we can work together to really meet the need where it's most needed and not necessarily open superfluous additional residencies where that workforce need has already been met. So we committed to having future meetings to really look at this of how we can drive those changes. And it is my intention and our ACEP leadership's intention to meet with everyone on that group who started residencies to really look at the drivers, to share this information and to really have an open dialogue about the growth of emergency medicine residencies and how we stem that or at least curb it in a responsible manner to meet the need where it's most needed. So hopefully that's give you some more information. It's great to see everybody. And thank you again. We'll keep you posted on future workforce updates.